Bismillahirrahmanirrahim. Assalamu alaikum everyone. Today's topic is dental amalgam, and that is basically a type of direct restorative materials. The previous lectures all have been on direct restorative materials, so we are starting with the direct restorative materials, and all the upcoming lectures will be of direct restorative materials. So today we begin with dental amalgam. So the objectives are to define what is amalgam and its composition, classify the different amalgam alloys and their properties, explain the amalgamation process, describe the setting chemistry of different amalgam types with emphasis on the stoichiometric phases being formed in both the high and low copper types. Explain in detail the steps of amalgam manipulation and restoration. Understand the phenomena of creep and causes of amalgam failure. Understand what is delayed expansion and its effects, and have knowledge about mercury toxicity, its biological effects, as well as the proper disposal of mercury. So firstly, it's very important to understand what do we mean by amalgam. Amalgam basically means a mixture of two or more things. And in case of dental amalgam, so it is an alloy of mercury with silver, tin, copper, and there also may be some zinc, palladium, indium, selenium to improve the handling and clinical properties. And the process of mixing the liquid mercury with one or more metals or alloys to form amalgam is called amalgamation. So as you can understand that basically it is a mixture of more than one metal alloy which is mixed with mercury, and that process obviously is known as amalgamation. So the amalgam alloy is composed of basically silver, tin and copper, and then there are other ingredients like zinc, indium, palladium and platinum in trace amounts. So if you want to understand the concept of amalgam, this diagram is a very clear representation. So before reaction we have an alloy and mercury which are dispersed with each other, and after the reaction takes place, that is mercury when it reacts with the silver alloy, it forms a matrix, uh, a matrix that contains the alloy, metal alloy, which is held within the reaction products. So basically, this is what amalgamation is. So why amalgam? There are lots of reasons that amalgam has been used for the past 200 years and with success, because it is able to withstand high stress bearing areas. It has long clinical survivability or durability, adequate resistance to fracture. It, it can maintain the anatomical form of the tooth. It is easy to insert and not overly technique sensitive, and micro leakage basically or corrosion basically prevention after a long period of time. So these are the features that are found in amalgam which makes it so popular till date. However, with the advantages of, obviously there are a lot of drawbacks as well, which is the reason why amalgam has been replaced mostly by aesthetic or tooth colored materials like. So let's look at the limitations. And the first and main limitation is the fact that it is unesthetic. It is silver colored, so obviously no one likes to have silver fillings in their interiors. Hence, it's limited to the posterior teeth. It is subject to corrosion because obviously it contains an alloy of metals. Then the phenomena of creep exists. Then it can undergo marginal breakdown, leading to ditching and ultimately failure. And then the major issue of mercury toxicity. So let's look at the classification of amalgam alloys. Amalgam can be classified according to three main factors: the shape or the geometry of the alloy particles, the amount of copper present, and the amount of zinc present. So let's look at them individually. Based on the particle shape or the geometry, they may be classified as lathe cut or irregular alloys, As you can see from the picture, this is a microscopic view of lathe cut or irregular alloys, and you can appreciate that the particles are irregular and prismatic in appearance. And then the other type is the spherical alloys. Again, from the picture, you can appreciate that they are very regular, rounded structures. Classification based on the copper amount. So there are two types, low copper and high copper. Low copper are further divided into the lathe cut or spherical, which we saw in the previous slide, and the high copper are divided into admixed and single composition. So the classification is very important, and you should have knowledge of all the three types of classifications. You may be asked either one of them. Let's look at the composition of low and high copper amalgam alloys. So basically, low copper contains about 69.4% silver, 26.2% tin. Copper is present only in 2 to 5% amounts. Then zinc and indium are present in very less amounts. If you look at silver, it is less in the high copper, about 60%. Tin is around about the same, 27%. The main thing is uh, is the percentage of copper, which is about 13 to 30%. So this is the main difference in low and high copper. As the name suggests, is basically the difference in the percentage of copper present. So let's look at the particle shape. In low copper, it's irregular or spherical, which is lathe cut or spherical. High copper admix may be again irregular or spherical. Admix unicompositional may be irregular and spherical. And then there is the single composition or unicomposition, which is just spherical. And again, the composition, the percentage of the metal or the element present is given. As you can see that the copper is present in the highest amounts in admixed unicompositional and unicompositional, and obviously in low copper it is present in the least amount of 2 to 5%. And finally, the third classification based on the zinc amount. So there are two types of alloys, zinc containing alloys and non-zinc alloys. So the zinc containing alloys contain zinc in excess of 0.01%, and non-zinc alloys contain less than 0.01% zinc. So these are the three major classifications of amalgam. So let's move on to the concepts of alloy and the phases formed. So as you all know, alloys are a combination of two or more elements, and at least with one of them should be a metal. So silver amalgam is basically an alloy of silver, tin, and copper. Metals are soluble in molten form, and based on the composition and temperatures, as we studied previously in metals, the solutions of different metals may be formed. Now, a solid solution may be formed, an intermetallic alloy may be formed, or a eutectic alloy may be formed. So if the two metals are completely soluble in solid state at atomic level, one phase is formed only, and this is called as a solid solution. So most of the alloys in dentistry are solid solution, as you are aware, especially those of gold alloys. Now moving on to eutectic and intermetallic alloys. When two metals are not completely soluble, a complex alloy system results. And as you know, in solid state, a mixture of two or more phases are formed, and at different compositions and different temperatures, different phases exist. So in amalgam, the silver copper is the eutectic system, as when the reaction is taking place, two phases are formed, the silver rich phase and the copper rich phase. And similarly, silver tin, which also forms side by side, is an intermetallic. So the amalgamation reaction involves the alloy powder particles reacting with liquid mercury, resulting in a matrix with a central unreacted alloy particle core and a reacted layer that surrounds it. So this is basically what we call amalgam. Different phases that are formed during this reaction. The phases in amalgam alloy are the gamma phase, which is Ag3SN, then gamma 1, which is Ag2 Hg3, so silver mercury, then gamma 2, which is tin mercury, then beta which is silver tin, then epsilon, which is Cu3SN, and eta, which is Cu6SN5. Now let's discuss the phases one by one. Silver and tin make up the major portion of amalgam alloy present in both the high and the low copper amalgam alloys. Alloy with 27% tin and 73% silver slowly cool below 480 degrees C, an intermetallic compound as we discussed, which is silver tin, is formed, also known as gamma. So when this intermetallic compound is mixed with mercury, it produces silver mercury and tin mercury phases, forming dental amalgam of the desired properties. And if the concentration of tin is less than 26%, a beta phase is formed, which is a solid solution of silver and tin. So it all depends upon the concentration of tin as well as. In addition to phase formation after amalgamation, some silver tin particles remain unreacted, as we saw in the diagram. So the unreacted core acts as a strong filler and strengthens the amalgam. The influence of silver tin on amalgam properties. Larger or smaller quantities of the tin in the alloy affect the final properties. So as we mentioned, if the tin concentration is more than 26.8%, mixture of gamma and tin rich phase forms, and the tin rich phase increases amount of tin mercury, which is gamma 2, and this is also known as the weakest phase. Gamma 2 or tin mercury is known as the weakest phase because its mechanical strength is the least at this time, shows the highest corrosion and highest creep. As you all must remember that creep is basically a time dependent plastic deformation, and this is a property of amalgam that over time it tends to go plastic deformation. Now, if you look at silver, what is the function of silver in the alloy? It decreases creep, it increases the strength, increases the expansion on setting, it increases the tarnish resistance, and decreases the setting time. Tin controls the reaction between silver and mercury as we saw previously. Without tin, the reaction is too fast and there is more setting reaction. It reduces the strength and hardness and reduces the resistance to tarnish and corrosion. So that is why it is very important that the manufacturer manages the composition of the alloy, and nothing is in excess and nothing is in less amount. Copper. Now copper is found in higher quantities in high copper admixed amalgam alloy, and especially the silver copper eutectic phase. It contains about 71.9% by weight of silver and up to 30% by weight of copper. So they contain both a copper rich phase and a silver rich phase with a crystal structure of pure copper and. So what is the effect of the silver copper eutectic alloy on the dental amalgam? So when mixed with mercury, it reacts preferentially with silver tin and as a result produces another phase, which is the eta phase, also known as Cu6SN5. So how high copper amount replaces the gamma 2 phase, the SNHG phase, which was the weak phase, giving a strong phase, which is the eta phase, and this is called the strong phase because it shows high mechanical strength, less creep, and high corrosion resistance, totally opposite to the gamma 2 phase. So that means that a high copper content results in a stronger amalgam due to the replacement of the gamma 2 phase by the eta phase, and hence improving the mechanical properties, decreasing the strength, decreasing the creep, and increasing the corrosion resistance. Now, what is the role of zinc? So, zinc acts as a scavenger or deoxidizer during melting of alloy. So, what is the function of a scavenger? Basically, it unites with oxygen in molten form and it absorbs the gases that are being formed during the melting of the alloy. Formation of slag that can be removed and minimizes the formation of other oxides and basically prevents oxidation. So, in the manufacturing of amalgam alloy produces a clean sound casting. And without zinc, amalgam is brittle and less plastic during the condensation and carving procedure when we are manipulating it at the chair side. So it is an important component that not only does it act as a deoxidizer, but it gives amalgam its plasticity and improves the handling properties. And a disadvantage of zinc is a very important phenomena which is often asked, delayed expansion. So excess of zinc or zinc actually itself causes delayed expansion. Due to moisture contamination, the zinc reacts with water, produces zinc oxide and hydrogen gas. Now, this hydrogen gas, when it is liberated, it is usually liberated 3 to 5 days later, and patient complains of a pressure pain. And this is because as soon as the hydrogen gas is released, the amalgam filling tends to expand and move out of the cavity, and this causes a pressure pain. So this is known as delayed expansion, delayed because it always presents about 3 to 5 days later. This means if we are handling a zinc containing amalgam, we should be very careful that there is no moisture contamination. Then indium decreases the amount of mercury required, decreases the mercury vapor during and after setting. So oxides of indium are formed, increases the wetting, so enhances the flow and ensures there is better mixing between the alloy and the mercury. Low creep, low early strength, but higher final strength than amalgam without indium. Then palladium and platinum, these increase the corrosion resistance and contribute to better mechanical properties of the finished amalgam mask. And these are all present in very trace amounts. Now let's talk about mercury, which is the liquid we mix with alloy. Mercury along with gallium is the only metal that is liquid at room temperature and pressure. So what when we are doing an amalgam filling, we mix the amalgam alloy powder with liquid mercury, which is known as amalgamation, and this produces a plastic mask that can be condensed in a cavity. So we have already prepared the cavity in the tooth, and the amalgamation produces a plastic mask, and that can be easily condensed into the cavity and carved and shaped to give the anatomical shape of tooth. And on as it sets, it makes a strong hard mass. And however, the main concern is mercury, as you know, is toxic and has to be handled with absolute care. Mercury contamination is a major issue, so you have to be very careful when mixing amalgam and mercury. You have to take certain safety precautions and ensure that it is not inhaled, it is not ingested, or it does not spill. Highly reflective surface shows no contamination, and it is before being delivered to us by the manufacturer, it is triple distilled to ensure that there are no contaminants or impurities with it. Now, gallium-based alloys. Due to the rising concern of mercury toxicity, gallium has also been used to alloy the silver amalgam powder. It can be used as a substitute for mercury, and it becomes a liquid at basically slightly above room temperature and can be alloyed successfully with indium and tin. However, the results weren't very promising, so basically it was discontinued, and we still are using the mercury based alloys in practice. So, if we talk about the amalgam alloy powder, as we mentioned that there are the lathe cut or the irregular alloy and the atomized or spherical powder. This was also the classification according to the particle shape or the geometry. So, how are they manufactured? Just a brief idea that the lathe cut or irregular particles, as the name suggests, and you can see from the picture, they're irregular crystals, and the metal is heated, melted, and poured into a mold to form an ingot, and different phases are formed at this stage: gamma, beta, epsilon, and eta. Then the ingot or the block is cooled, and it is cut by placing in a milling machine or lathe machine, and needle-like chips are formed and they are passed through a sieve and ball mill to form the proper size. So the particle size is usually 60 to 120 microns in length, and then finally there are certain heat treatments that are carried out to improve the shelf life, and you don't really have to go into these details. And the atomized or the spherical powder. So spherical powders may be of both low or high copper and produced when all desired elements are melted together. And in molten stage, the desired form, metallic ingredients form the desired shape, which are irregular sphere-like structures. And how are they achieved? The liquid metal is sprayed under high pressure of an inert gas through a fine crack, and fine spherical droplets of metals are formed. And then they are also given certain heat treatments and acid wash to get a final proper spherical amalgam alloy. So you just have to know, you don't really have to go into the detail of these procedures. You just have to know how lathe cut and spherical particles are formed. Just basically the general idea. So this is what atomization of the spherical particles looks like. So let's look at the different types of amalgam again. Low copper and high copper. High copper contains the admix and the single composition. Move on to the setting reaction of amalgam. So all the reactions of the different types of amalgam, both low copper and high copper, are important, and this is always asked in the exam. You have to write the proper balanced equation of the reaction of amalgam. You have to know what phases are being formed, and the resultant product, the different properties, the mechanical properties, its corrosion resistance, and the fact that is free present or not. Is intimately mixed with mercury to wet the surface of the particles when we are carrying out the amalgamation reaction. And as soon as the liquid mercury contacts the surface of the silver tin, the beta and the gamma phases alloy particle, the silver in tin dissolves into the mercury, and mercury also diffuses into the gamma phase of alloy. So basically, if you look at the diagram, this is a silver tin alloy. The tin, the silver, they leach out, and the mercury starts reacting with them. It wets all the particles. So, and the central core is the unreacted alloy, strongest phase and corrodes the least. And this is the gamma phase, which is Ag3 Sn, and forms 30% of the volume of set amalgam. So the gamma phase is the strongest phase and corrodes the least, and this forms almost 30% of the bulk of the set amalgam. It is also the unreacted alloy. So mercury has limited solubility for silver and tin. After the solubility in mercury is exceeded, crystals of two metallic compounds, precipitation of gamma 1 begins. It acts as a matrix for the unreacted alloy. So we have the unreacted alloy, which is silver tin basically, and then which we said was the strongest phase, and then we have gamma 1, which is basically the matrix of the unreacted alloy, and that is Ag2 Hg3, and this is the second strongest phase after gamma, and this contains about an average of 60% by volume of the major bulk of the alloy. So the next phase to precipitate out is the gamma 2 phase, also known as the weakest and softest phase, and the gamma 2 is basically tin mercury or SN8Hg. It corrodes the fastest, so voids are formed, and corrosion basically forms mercury, which reacts again with more gamma, making gamma 2. But luckily, it just makes up 11 to 13% of the volume or the bulk of the alloy, and this decreases with time due to corrosion. So it's called the weakest and softest phase because firstly the mechanical properties are very poor. It has low strength and hardness. The corrosion resistance is low, and it has high creep. So these are the phases that form in low copper. The final resulting microstructure, so gamma 1 and gamma 2 crystals are being formed. Amalgam is soft and condensable. The crystals grow, remaining mercury dissolves, they interlock, amalgam gets hardened, And at this stage, clinically, it is no longer condensable. You cannot give it any further shape. So you have to do the shaping and the filling basically, or the condensing of amalgam before this stage is passed. Working time is the lapse of time between the end of trituration and when the amalgam hardens and is no longer workable. So let's go back to the resulting microstructure. The final product is a composite of low copper amalgam containing some unconsumed or unreacted particles embedded in both. So the unreacted unconsumed particles are basically the gamma phase embedded in gamma 1 and gamma 2 phases. And as I mentioned that the reaction is very important, so let's look at it. So basically alloy particles beta and gamma plus mercury equals to gamma 1, which is the silver mercury, plus gamma 2, which is tin and mercury, and the unconsumed alloy particles, which is again beta and gamma. So this is very important. You have to know the complete setting reaction and the equation of all the types of amalgam. This is basically a pictorial representation. Alloy reacts with mercury. You get three phases: gamma, gamma 1, and gamma 2. So now let's talk about the characteristics of the or properties of the phases formed in low copper amalgam. So the more the unconsumed or the unreacted silver tin, stronger is the amalgam. As we mentioned, gamma 2 is the weakest, and hardness of gamma 2 is approximately 10% that of gamma 1, and gamma 2 is least stable in corrosion environment. That is why the corrosion resistance at this point of amalgam is the lowest. So that was the low copper amalgam. Now let's move to the high copper amalgam. The setting reaction is very different and the phases formed are also very different. High copper amalgam is the current material of choice and it has replaced the low copper amalgam because of the improved mechanical properties, better corrosion characteristics, and better marginal integrity. So there were two types of the high copper amalgam: admix and single composite. Both of the reactions of these types are different. Let's look at them separately. So in the admixed alloy, copper rich phase is present because obviously it is a high copper amalgam, and it eliminates the gamma 2 phase because it reacts preferentially with, with the mercury, which is weakest and susceptible to corrosion, increased residual alloy particle and decrease in matrix amount, and the residual particles act as a strong filler so that contributes to the strength. So in place of the gamma 2, the eta phase or Cu6SN5 is formed, and this surrounds the unconsumed silver copper alloy particles. So this is formed in place of gamma 2, and the gamma 1 phase forms obviously with eta phase and surrounds both eta covered silver copper alloy particles and the silver tin lathe cut alloy particles, because the admix is a mixture of both the lathe cut and the spherical particles. So the gamma 1 phase surrounds both of these particles. Let's look at the chemical reaction. The alloy particles beta and gamma and the high copper eutectic alloy, which is silver copper and mercury, react, and what do we get? We get gamma 1, which is Ag2 Hg3, and then we get the eta phase, which has basically replaced gamma 2, which is Cu6SN5, and then the unreacted eutectic alloy and unreacted Ag3SN, which basically contributes to the strength and the bulk of the resulting amalgam. Now let's look at the diagrammatic representation of the setting of admixed high copper amalgam. So the gamma spheres in the silver alloy, they react with mercury and you get gamma, gamma 1, and the eta phase. So that was the admixed amalgam. Now let's look at the chemical or the setting reaction of the single composition alloy. Now in the single composition alloy, as the name suggests, basically it is just uh, containing the spherical particles which have the same chemical composition, and basically three phases are present: the beta, which is Ag4SN, gamma, which is Ag3SN, and epsilon, which is Cu3SN. So the greater amount of epsilon is finally dispersed within the Ag3SN phase. Copper content in single composition ranges between 13 to 30% by. Let's look at the reaction. So what happens is that the gamma 1 crystals grow, binding together partially dissolve the gamma alloy particles. Now, eta crystals are found as meshes of rod-like structure developed on the surface of gamma particles and disperse in the matrix. Obviously, this reduces creep and prevents the gamma 2 formation. Let's look at the resulting microstructure and the chemical reaction. So gamma reacts with epsilon, which is Cu3SN, and mercury to give unconsumed particles, which is a mixture of Ag3SN and Cu3SN, which was epsilon, and finally gamma 1 and eta. So eta is formed again in the final resulting microstructure, and in books you will find that for the spherical or the unique single composition high copper alloy, there are two reactions, and if it is best to remember both of them, but I have simplified it and just written the final reaction in which epsilon is converted into eta phase. So how is the single composition high copper alloy different? It has much larger, so in both eta is formed, eta crystals are formed, but in the single composition high copper alloy, the eta crystals are much larger. So I hope the setting reactions of the low copper and the high copper, both admixed and single composition alloy, is clear. Like I mentioned, you should know the proper balanced setting reaction, the chemical reactions, the phases formed, and as a result, the properties of those three different alloys. So let's now talk about the general properties of amalgam. Amalgam has dimensional stability, excellent strength. However, it shows creep. It has. Let's talk about the dimensional stability. So, according to the ADA specification, it states that amalgam should neither contract or expand. The limit is minus 15 to plus 20 microns per centimeter. If contraction happens, what will result? Marginal gap and micro leakage, leading to secondary caries, plaque accumulation, sensitivity, and ultimately failure. And at the same time, if expansion occurs, what will happen? The filling will protrude out from the cavity. This will lead to pressure on the pulp and pain, and also post-operative sensitivity. So basically, your amalgam should neither contract nor expand with beyond the given limit. So let's look at the dimensional changes that take place when amalgam is setting. Initial contraction occurs, then expansion. Contraction due because the particles are dissolving and there is growth of gamma 1 crystals continues as long as the growth of gamma 1 takes place. Gamma 1 crystals impinge on each other, outward pressure produced, and that ultimately leads to expansion. So there is initial contraction followed by and the atomized or the spherical powder. So spherical powders may be of both low or high copper and produced when all desired elements are melted together. And in molten stage, the desired form, metallic ingredients form the desired shape, which are irregular sphere-like structures. So what are the manipulative processes that affect the dimensional stability? So increase in mercury can lead to contraction. And how can that result if you use high condensation pressure? So by that, what will happen when if you condense the amalgam alloy with high pressure, the mercury will leach out, and that will lead to increased mercury, leading to and it will lead to basically mercury leaching out and hence lead to contraction. Longer titration time and use of smaller particle size. These are all the different uh, factors that can lead to contraction within the alloy. High condensation pressure actually squeezes the mercury out of the amalgam and hence leads to contraction. Longer titration time and use of smaller particle size, it also leads to contraction because if the particles are smaller, then there is more surface area. So if there's more surface area, more mercury is needed and more particles dissolve, silver enters solution faster, consumption of mercury is accelerated. So these all lead to. So the modern or the newer amalgams, which are the high copper amalgams, reveal a net contraction as compared to older amalgams. So because older amalgam contained large lathe-cut alloy particles and were mixed at a high mercury ratio with hand titration, and obviously when any procedure is done manually, there are the chances of human error. So there was high expansion. Now the high-speed mechanical amalgamators or the newer mechanical methods used now consume more mercury, so show more contraction as a result. So post-operative sensitivity, as we mentioned, was related to dimensional change. Amalgam does not bond to tooth structure. So if there is any kind of contraction, it moves away from the margins and that leads to interfacial gap. During cavity preparation, cutting of dentine causes pulpal fluid to flow upwards. Due to contraction in amalgam, these interfacial gaps fill with fluid because of the consumption of when we are eating and taking liquids. So these gaps fill with fluid, and any change in pressure of this fluid causes post-operative sensitivity. So there is calculus a deposit over there. It can lead to secondary caries as well. And there are a lot of other clinical factors that can lead to post-operative sensitivity. We can overcome the post-operative sensitivity of amalgam by using certain bonding agents to seal the dentinal tubules or the use of cavity varnish so a good marginal seal is produced. These things will make more sense when you study the clinical aspect in operative dentistry. So we mentioned delayed expansion or secondary expansion. That is obviously also a dimensional change. And this, as mentioned, takes place in the zinc containing low copper or high copper amalgam. So it is basically related to the presence or the presence of zinc and mainly by contamination with moisture during trituration. As I said, that the zinc reacts with the water and it leads to the production of hydrogen gas, which causes the filling to expand and an internal pressure to build up. And expansion is always up 3 to 5 days afterwards and continues for months. And the patient complains of a pressure-like pain. And this is called delayed expansion or secondary expansion and occurs exclusively in the zinc containing amalgam. Now let's move on to the mechanical properties of dental amalgam. Now the strength of dental. It is highly resistant to compressive stresses. It is viscoelastic. High loading rate gives high strength. However, a drawback is that it is brittle, so it is weaker in tension and shear. And rapid stress application does not produce plastic deformation. It is susceptible to marginal breakdown. So marginal breakdown is basically present in amalgam, and what happens is that because it is brittle, it tends to fracture from the margins. It, however, has good resistance to abrasion. So the strength of the amalgam is determined by the amount of matrix and the unreacted particles. And basically, the more the unreacted alloy, the higher the strength of amalgam. And silver mercury and tin mercury act as a matrix, which are basically uh, gamma, the gamma, the gamma 1 and gamma 2 phases. So if gamma 1 and gamma 2 phases are present in smaller amounts and the unreacted particles are present in higher amounts, higher is the strength. So what happens if there is a high mercury content? This favors the formation of the matrix, which is the gamma 1 and gamma 2 phases, rather than the unconsumed or the gamma particles. So more the gamma 2 and gamma 1 phase, that is more the matrix than the gamma phase, weaker is the amalgam. For the high copper admix or low copper amalgam, increase in mercury content more than 54% has shown to have a reduction in strength. So optimum properties are produced for amalgam having about 44 to 48% mercury. And those proportion at more than 50% mercury are necessary to reduce the level at manipulation. So this is a very important factor, that the ratio or the mercury content should not be more than 54%, and ideally 44 to 48%. This produces the best. However, on the other hand, if we use less mercury, the resulting mixture will be granular and dry, resulting in a pitted surface, and because the mercury is necessary to wet the alloy particles. Now, effect of the particle size on strength. Smaller size particles increase surface area per unit volume of powder, but they require more mercury to form an acceptable amalgam mass. So the favorite technique is small average particle size. The modern powder size is 15 to 35 microns, and it produces more rapid hardening of the amalgam and provides a greater early strength. Let's look at the difference between lathe cut and the spherical alloy particles. This is also a very commonly asked question. So lathe cut particles when packed have more voids or spaces in between them, because obviously they're irregular and a higher surface area. Hence, as a result, they require more mercury to fill the spaces. So, amalgam containing lathe cut or a mixture of lathe cut and spherical, as the case in admix, tend to resist the condensation forces. If we look at spherical alloy particles, they give good packing because they're the same size and they're regular spherical particles, leaving less space and wet easier with mercury and have less surface area. So they require lesser amount of mercury and as a result are more plastic. So this is the difference between the particle. This is basically the difference between the two types of amalgam alloys and the consumption of mercury. Tensile and transverse strength of amalgam is lower than the compressive strength. That is why we say that it is a brittle material. It is weak in thin sections. That is why it can fracture easily from the margins. So it needs adequate support from the surrounding tissue. Let's look at the strength of the different phases in the low copper amalgam. If we look at the three phases, gamma, gamma 1 and gamma 2. So the strongest is the gamma phase, which is Ag3SN, also known as the unreacted alloy. Then comes the second strongest is Ag2 Hg3, which is gamma 1, and the weakest obviously phase of all is SN8 Hg, which is also known as the gamma 2 phase. Spherical particles in copper-enriched alloys develop more strength rapidly than the conventional lathe-cut materials. Effect of amalgam hardening rate. So, when we talk about the strength of amalgam, we look at it at two different points. The 1 hour strength, which is only 6% of the compressive strength, and the minimum requirement is said to be 80 megapascals, and the patient is always given the instructions that at least for 1 to 2 hours he or she should not eat anything hard and not chew from that side. The reason being that only after 1 hour only 6% of the compressive strength has been achieved. So always instruct the patient not to bite for 8 hours after placement. Usually we say that do not eat from this side for at least 1 day, but actually after 8 hours it gains 70% of the strength. So the 1 hour strength of dental amalgam of the single composition type, they compared to the old and the conventional low copper amalgam have the highest 1 hour strength. They achieve more than 250 megapascal of strength by the first hour. so they can reduce the possibility of premature fracture by application of high occlusal loads. So in that case, we don't have to tell the patient to wait for one whole day or 8 hours. And the lowest 1 hour strength is of low copper alloy, as mentioned in the previous slide. It is just 6%, and that is about 45 megapascals. Tensile and transverse strength of amalgam is lower than the compressive strength. That is why we say that it is a brittle material. It is weak in thin sections. That is why it can fracture easily from the margins. So it needs adequate support from the surrounding tissue. Now let's talk about trituration. So trituration is basically the means by which we are carrying out amalgamation. Practically, we'll be doing it manually. I'm showing you the demonstration as well. The trituration is basically simply the mixing of amalgam alloy with, with the liquid mercury. The process is called trituration. And what is the effect of trituration on strength? It again depends upon the type of amalgam alloy you are using, the time, the speed, if you are using the mechanical means of trituration by amalgamator. Under trituration, that means if you undermix it, effect of condensation on strength. Condensation is the next step that follows when you actually place the mixed amalgam into the tooth cavity and you apply condensation pressure so that the filling adapts to the walls of the tooth and reaches its desired shape. So the greater the condensation pressure you apply, especially in lathe cut alloys, what it does, it basically expresses or releases the excess mercury out, so higher strength is achieved. However, in spherical alloys, as there is less amount of mercury, light pressure even produces high strength. So even if you apply light pressure, because there's already less amount of mercury, and when even that mercury gets removed, so high strength is achieved. Effect of porosity. Voids and porosities affect the compressive strength, obviously, because there is decreased plasticity due to delayed condensation or undersaturation. The more the porosity or the faults or the cracks, the less the strength. Increased condensation pressure allows for adaptation and margins and lower in number of voids. So to avoid porosity, we can increase the condensation. So we've discussed the strength or the mechanical properties of amalgam. Let's talk about creep. Creep is a major issue in amalgam, and there are two types. Static creep, which is both are the time dependent plastic or permanent deformation. However, static, as the name suggests, is basically the deformation due to a constant stress, whereas dynamic is basically present in materials when the applied stress is fluctuating, such as fatigue. So the masticatory forces bring about dynamic creep because obviously they're not constant, they're different at different doing different functions. So these are the two types of creep, and amalgam is subjected to both static as well. It is defined as a time-dependent plastic deformation of materials that are used at temperature close to their melting point. So melting point of gamma one has is basically 400 Kelvin, and the mouth temperature is 310 Kelvin. So amalgam shows no creep at this. So the static creep in amalgam causes the amalgam to flow. So unsupported amalgam protrudes from the cavity margin, leads to marginal deterioration, weak edges, possible ingress of caries, which is also known as secondary caries, and it is more prone to corrosion, ditching, and finally failure. So that is why creep is something that we should be very vigilant about, and there are certain ways to actually decrease this in our amalgam filling. And as you can see from the picture, I'm sure you can appreciate that the amalgam has basically protruded out from the margins, and it has kind of moved from its original place. So this is why it's called creep. This is what marginal breakdown is. So the forces are being applied on the tooth at the margin, and because they are brittle in weak sections, it leads to marginal fracture. And what is ditching? Basically, when from the margins, the amalgam gets fractured, or it gets worn off. So basically, from the center, it starts ditching or moving inwards, and ultimately, this filling fractures, and it leads to the failure of the restoration. Failure at the edges where the material breaks off is called. And this diagram shows creep. As you can notice how the amalgam moves away from the margins towards the center, and this movement or plastic deformation or plastic strain is known as creep. So let's look at creep. What are the factors that influence creep? So first of all, as we discussed, the gamma 2 phase was the weakest phase and most prone to creep and corrosion. The gamma 2 increases the creep rate. More than 1% creep shows the presence of gamma 2 phase, and gamma 2 phase basically allows the sliding of gamma 1 phase, so more creep is present in the low copper amalgam. So that is why we should use the high copper amalgam, so that the gamma 2 phase is totally eliminated and there is less chance. The creep in high copper is less than 1%, and especially in single composition, as the large eta rods act as a barrier to deformation of the gamma 1 phase, and small quantities of other metals like palladium also have shown to decrease the creep, and they are present in the high copper alloys. So the manipulative measures on creep, what can you further do to decrease creep? So the low mercury alloy ratio, because basically creep is taking place due to mercury. If you keep the mercury alloy ratio low and apply high condensation pressure, so again for lathe cut or admix, so that again the excess mercury is removed, this leads to a decrease in creep. So these are the manipulative measures as a dentist you can do, so to further decrease the chances of creep in your filling. Now let's look at this is a very good table. It summarizes the properties we have discussed so far in amalgam. If we look at the compressive strength, let's move on to the compressive strength at the 7th day or 1 week. So in low copper it is 343, admix 431, and as you can see um, that in the single composition high copper it is highest, and that of 510 megapascals. Creep is highest in low copper, followed by admix, and the least in the single composition. And tensile strength, though low in amalgams, it's the highest in the single composition, and lowest in the admixed. Now another very important property of amalgam, corrosion. And so we've discussed corrosion and tarnish previously. So let's go over the definition again. Corrosion is basically the progressive destruction of metal by chemical or electrochemical reaction with its environment, and this affects the structure and substructure as well as the mechanical properties. So what happens due to corrosion? Corrosion causes firstly the poor appearance or loss of aesthetics of the restoration, because it appears black and darkened. It increases the porosity. It reduces the marginal integrity, leading to ditching and failure, leads to loss of strength and release of metallic products or the corrosion products as a result of corrosion, which may cause toxicity, as these products are leached into the oral environment, and they may lead to metallosis over time, and they may deposit into the major organs. So that's why corrosion has many detrimental effects on the filling. So let's look at the corrosion in different phases. The gamma 1 or Ag2HG3 has the highest corrosion resistance, and as you can see at the bottom is tin mercury, which is gamma 2, and this has the least corrosion resistance, and it is most prone to corrosion because this phase is the weakest phase and it consists of mercury. So that's why it is the highest, or it's most prone to the corrosion. Now let's look at the effect of phases on corrosion. As we said, the gamma 2 phase is most prone to corrosion. It is because it's most electrochemically reactive and forms the anode in an electrolytic cell. And because it forms an anode, it breaks down to give tin containing corrosion products as well as mercury. As you know, mercury ultimately decreases the strength. So less corrosion in copper rich gamma 2 free amalgam, because in high copper the, the copper tin phase acts as the anode. Now, when corrosion occurs subsequently, what happens that the corrosion products are formed and they are usually oxides and chlorides of tin, and they are found at tooth amalgam interface or within the bulk of older amalgam restorations. Less commonly found in high copper amalgam because obviously corrosion is very less in high copper and phases most anodic of the phases present. The corrosion products in high copper amalgam, well, there are very less chances of them being formed, and again, they're oxides and chlorides or hydroxides. But due to the large eta crystals and phases in high copper amalgam, corrosion process is limited, and that amalgam is less susceptible to corrosion than gamma 2 phase of low copper amalgam. So we talked about corrosion and amalgam, or what phases contribute to it, and then obviously the detrimental effects of corrosion and amalgam. But at the same time, it's been said that corrosion is actually helpful and beneficial in amalgam. Now, why is that? Because the corrosion products we discussed in the previous slides actually seal the marginal gap. As we discussed that over time there may be an interfacial or marginal gap between the tooth and the amalgam because they're not bonding to each other. So the corrosion products that are formed over time due to corrosion may actually seal this gap, and this seal actually inhibits the ingress of oral fluids and bacteria, and so that prevents secondary caries or sensitivity, and finally any kind of failure, ditching, and this makes it self-sealing. So the products actually self-seal the margins of the tooth and filling. So that is why we can say that there is along with the harmful effects of corrosion, the corrosion also contributes to of somewhat of a protective role in amalgam, and that is it makes it self-sealing. So we discussed corrosion. What is tarnish? Tarnish is a physical property which is just a discoloration of a metal surface when sulfides, oxides, and chlorides or other chemicals cause a thin film to form. So it is just limited to the surface. The substructure is not involved. Integrity of the alloy is not affected. There are no changes in the mechanical properties, and basically it's due to the formation of a layer of sulfide on the surface of the filling, and has more aesthetic issues rather than causing any kind of changes in the properties, in the mechanical properties specifically. So how can we prevent tarnish and corrosion? Well, they can be removed. Tarnish can be removed by polishing the surface, and if polishing does not restore the material, the amalgam filling, this means that the tarnish has been replaced by corrosion, and it has basically penetrated into the structure. And the only solution is to replace the amalgam filling. So you can do nothing about corrosion. You have to ultimately replace the restoration, but tarnish can be removed by polishing. Now let's talk about galvanism. I'm sure and I'm hopeful that you remember what galvanism was. So galvanism was basically a phenomena due to the combination of dissimilar metals in physical contact within the oral cavity. Like for example, two different metallic restorations coming in contact with each other, like an amalgam restoration and gold alloy. So when because they have different electrode potentials, they come in contact with each other, and saliva acts as an electrolyte, and current or a cell is basically electrolytic cell is set up, and that causes a current to actually flow within both. One acts as the anode, one acts as the cathode, and this flow of current actually leads to a sharp shooting electric current like pain, and this phenomena is known as galvanism. So a galvanic cell is set up. So galvanism is an important consideration in amalgam, also a disadvantage of it, because again, if it is present along with an opposing different metallic restoration, this phenomena can occur. So we have to be very careful when giving an amalgam restoration. We should ensure that there is no opposing dissimilar metal within the arch. Now let's talk about the manipulation of amalgam. This is a totally clinical part of our topic, and but we'll try to make it as simple and understandable as possible. Let's talk about the dimensional stability. So according to the ADA specification, it states that amalgam should neither contract or expand. The limit is minus 15 to plus 20 microns per centimeter. If contraction happens, what will result? Marginal gap and micro leakage, leading to secondary caries, plaque accumulation, sensitivity, and ultimately. So, uh, the manipulative variables are very important, and if the are very important factors affecting the success of the amalgam filling, and a good modern dental alloy can be manipulated so the restoration lasts for an average 12 to 15 years, and there are people who have amalgam fillings as old as 40 to 50 years. So it's a very durable material, and the factors again are the mercury alloy ratio, the trituration method, the consistency of the mix, the condensation, carving, finishing, and all the steps that are basically involved in the amalgam restoration. Let's talk about the mercury alloy ratio. So the low copper lathe cut alloys have 1 is to 1 or 50% mercury, and the spherical alloys because they require less mercury, they contain 42% mercury. So the mercury percentage varies from 42 to 54. This is the range that we try to keep properties. Um, so again, the mercury ratio is very important. Excessive mercury has deleterious effects on the physical and mechanical properties of amalgam. As we saw previously, it affects the strength, it affects the dimensional stability, it affects the creep. Too low mercury content, what does it do? The mixture will be dry and grainy, it will not be plastic, it will impair the strength, it will have less corrosion resistance, and it will not allow the matrix to cohesively bond the mass. So how can we reduce the mercury left in the restoration? There are certain methods, clinical methods that you may carry out to reduce the mercury. By squeezing or wringing the mixed amalgam in a cloth before insertion into the cavity, that will ensure that the excess mercury is removed. And when you're doing condensation and burnishing, you can ensure that the mercury comes to the top and it is removed as soon as the restoration is built up. So these are just clinical procedures which you will have a better understanding when you actually carry out the filling amalgam fillings yourself. Now, a very important technique related to the amalgam manipulation is the Ames technique. So the Ames technique is basically a new technique named after the dentist who actually thought of it. So he said that the ideal ratio is 1 is to 1, and the this ratio means 1 is to 1 means one of the silver alloy and one of the mercury, and this is the best way to reduce mercury in the restoration by reducing the original mercury alloy ratio. Previously the mercury content was more in the alloy, and alloys designed for manipulation with reduced mercury alloy ratio. This so basically the newer mercury alloy like and the alloy like the high copper alloys, they require lesser mercury. So this was proposed by Ames, and this is known as the minimal mercury technique or Ames technique, which states that the ideal ratio is 1 is to 1, and that brings about the ideal and the best properties in the overall amalgam filling. So firstly, let's start with the manipulation, the steps. The first step would be the proportioning. So what you mean by proportioning? When you take out your mercury and alloy and you measure it or you weigh it. So parts by weight is 1 is to 1, or percentage is also 1 is to 1, which means 50% mercury, 50% alloy should be exact as suggested by Ames, that the minimum mercury technique be used. Proportioning can be done by various methods. You have volumetric disposable capsules. Mercury and alloy dispensers, well, we put in pre-weight tablets or pellets, and they have their own individual weight, and an accurate mercury dispenser is required. Mercury is measured by volume and they are mixed together. And then the other method is by the mortar and pestle, which we will be carrying out. We'll be demonstrating to you, and you will be asked to do the same in your OSPE. So you have a mortar and pestle, and you manually triturate the amalgam alloy powder and the liquid mercury. So, but for convenience, pre-proportioned capsules are also present in the market. So they come in the form of these capsule, and at one end there is basically the the alloy, the silver alloy powder, and at the other end of the capsule is the liquid mercury, and they are separated physically by a membrane, and the actual quantity of mercury and alloy is present. And what is the advantage of this pre-proportioned material or capsule form? It eliminates the chances of mercury spills. So when you're actually manipulating mercury uh, by the manual method or by placing it in the mortar and pestle, there are chances of mercury spills. And it has a reliable mercury alloy ratio because it is predetermined and pre-weighed, clean mercury free of dust, so that the dirty mercury does not react, because the dirty mercury does not react with the silver alloy. But it is expensive and minor adjustments cannot be made. So that, for example, if you feel that your mercury alloy mixture is not proper and you want to add more powder or say more mercury, you cannot do that because they contain a pre-weight, pre-proportioned amount from the beginning. So this is what it looks like. The mercury liquid is on the top, and there is a physical membrane, and then the powder is basically at the. So they come in two types: reusable and disposable. Basically, when we actually shake it, so what happens is that the membrane breaks and the mercury and the alloy get mixed, and there's less chances of mercury loss, and there's no need of dispensing the mercury and alloy. So these disposable amalgam capsules are self-activating, and they automatically release mercury into the alloy chamber in the first oscillations of the amalgamator. So this device is an amalgamator. This is basically a mechanical method to mix or manipulate amalgam. So what are the objectives? It provides for proper amalgamation because it's a mechanical process. There are less chances of error. Alloys are covered with oxide. Oxide is removed during the oscillations or abrasion, and the correct consistency, the correct ratio of the mix is achieved, and as a result, a better alloy resultant mix is achieved. So these are the objectives of trituration. Manual trituration, alloy and the mercury are mixed in the mortar and pestle. This is called manual mixing, and we do it by hand. We like basically by the mortar and pestle we grind, or we basically compress the amalgam and the mercury together, and we allow the liquid mercury to wet the powder completely and carry on basically triturating it till we achieve this kind of shiny silver mass. And whereas in mechanical trituration, we just place the powdered alloy and mercury, which is the capsule and pestle, within the amalgamator. Uh, uh, we choose the speed and the oscillation rate, and within few seconds, it is mixed into the desired proper mixture. So obviously, compared to manual mixing, it is more accurate. It saves time, and there is basically less chance. And this trituration is accomplished in usually less than 20 seconds compared to manual trituration, which it can take from 3 to. So we won't go into the details of amalgamators, but you just have to know it's a device used for mechanical trituration or mixing of the amalgam silver alloy and mercury. Advantages, again, uniform and reproducible mix produced, shorter trituration time, greater alloy mercury ratio can be used. So there are different variables in the mechanical trituration like the speed, the oscillation, and the speeds are mentioned here. But like I said, you don't have to go into the detail. You just have to know that there are two kinds of trituration, the manual and the mechanical, and just a few lines about how they're both carried out. So, just an important fact that the spherical alloy require less amalgamation time than the lathe cut because they are regular rounded structures of the same shape and size. So they get triturated earlier than the lathe cut or the irregular alloys. Let's look at the difference between hand trituration or manual trituration and mechanical trituration. So hand trituration is carried out using a pestle and mortar, the palm and thumb or pen grasp technique. It takes more time, about 45 seconds, and needs some experience. Mechanical trituration uses amalgamator and pre-weight capsules using amalgamizer with mechanical dispenser, accurate proportion, and saves time because it takes about 5 to 20 seconds, and you don't have to do anything. You just have to place in the capsule and wait for the amalgamator to do its job. So let's talk about the consistency of the mix. We have triturated the amalgam. Three types of mixes can be present: under triturated, normal, or over triturated. Under-triturated mix, they physically look dull and crumbly, and they are weak and have a rough surface after carving, and they are more susceptible to tarnish and have reduced strength. A normal mix appears shiny like in the picture. It shows that it is properly triturated and separates in a single mass from the capsule. It has good dimensional stability, a smooth carved surface. Now, an over-triturated mix, it will appear soupy and fluid, and it tends to stick to the inside of the capsule. It has over-trituration leads to high contraction, high creep, and strength of spherical alloy decreases with over time due to overformation of gamma 1 and eta products. And this occurs when we increase the reaction rate. And obviously, over-trituration leads to the decrease in the working time, but the disadvantage is that it ultimately leads to high contraction and decrease in strength and high grade. Under titration, what happens if you under titurated the mixture? Mercury will not completely wet the amalgam particles, so the it will not be plastic. No reaction will take place between mercury and alloy. It will remain limited to just the surfaces it contacted. Mass remains soft, so the working time will be increased. It will not set, and as a result, the compressive and tensile strength is reduced. Voids and porosity will form. The basically creep will be less, but corrosion resistance will also be less, and there will be insufficient formation of the gamma 1 and eta products to hold the particles within. So both types of basically conditions in trituration, if they are not met properly, it can lead to basically an ultimate effect to the mechanical properties as well as creep and corrosion resistance of the amalgam alloy. Now, what will happen to the dimensional stability? Prior to introduction of capsules amalgamators, traditional amalgam contained large particles and were hand triturated, and this caused slight expansion. High-speed mechanical amalgamators now have, however, because of the low mercury alloy ratio and high condensation pressure, reduced amount of mercury, and as a result, there is no expansion. In fact, it favors contraction. So this is the effect of titration on the dimensional structure. So now, after proportioning and titration, the next step is the condensation. So condensation, well, the goals of condensation are that we to compact the alloy into the prepared cavity until proper density is achieved, to remove the excess mercury if you are using low copper alloys, and basically to try and achieve less a filling that has fewer voids, and a compact and good filling is basically produced at the end of all the steps, and this results in increased strength of amalgam, low dimensional changes, and reduction in creep. So basically, these are the goals of condensation. This is what we should be expected to achieve. The different types of condensation are hand condensation or the manual condensation, mechanical condensation, and the ultrasonic condensation. Hand condensation involves the use of basically different hand condensers or instruments which come in different sizes and shapes. As you can see from the diagram, these are hand condensers or instruments that are used to carry out condensation. Size and shapes of condensers: they are small condensers which are 2 to 3 millimeter in diameter, and they affect more pressure and they are more effective. Used for low copper amalgam because we need to remove the excess mercury. Larger condensers, on the other hand, exert lower forces, and we use them for spherical amalgam as we don't need to apply that much pressure, and they contain less mercury and are more plastic. High condensation pressure actually squeezes the mercury out of the amalgam and hence leads to contraction. Now, hand condensation, there are few principles. You should not touch with bare hands because we don't want to contact the free mercury. After condensation of each increment, surface should be shiny, and we condense the amalgam in small increments, and mercury is brought to the top of each increment by this procedure, and it's removed right away. So this is also a method to remove the excess mercury. If the cavity is large, we prepare new mix because original one loses its plasticity over time. Now, mechanical and ultrasonic condensation. Mechanical condensers use tapping or vibrating movements, and basically they exert high load with high magnitude of movement. But a disadvantage is that if they are not, if basically this requires the dentist to be skilled and have the expertise to use these condensers, and if they're not used properly, it may cause tooth or cuspal fracture. Ultrasonic condensers, however, they use ultrasonic waves to carry out the condensation procedure. They are discouraged because it increases the local or internal heat of amalgam, and it gently increases mercury evaporation from the setting amalgam. So condensation pressure, it is recommended to increase the pressure from 3 to 7 megapascals, and this has shown to increase the compressive strength. 66.7 Newton force is recommended. So this ensures that maximum density and excellent adaptation to the cavity walls. Smaller the condenser, greater the pressure is exerted, and vice versa. So what happens if we delay the condensation? Well, we should carry out condensation immediately after mixing and before the amalgam sets. So any delay, especially in zinc containing alloy, results in amalgam may have attained some set, it may have already hardened, so the condensation effort is futile. Condensation of partially set material fractures and breaks up the matrix. Delayed expansion may take place, and weaker mass due to increase in mercury content and creep, which basically start taking place as soon as the condensation, as soon as this amalgam starts setting. So when we are condensing the amalgam within the cavity, it is recommended to overpack the cavity means to fill it to the top and in excess, and then finally start carving it. Now carving gives a chance to so basically over packing allows you to control the final shape and occlusion more closely, and the surface layers contains more mercury and so can give inferior properties. So that is why it is recommended that we overpack and then start carving. Now carving. What are the objectives of carving? Carving is the step that follows condensation, and as the name suggests, we basically rebuild the anatomy of the tooth. We remove the mercury rich layer from the surface and re-establish contact with the opposing dentition. So these are the objectives of the and we carry this out by using certain carvers. And when is carving started? When the amalgam is hard enough to resist carving, and this is usually 2 to 3 minutes after mixing. And this ceases as soon as the amalgam hardens. So we have about 5 to 10 minutes, and we check before carving. We check by piercing the amalgam filling slightly. If it forms an indentation and doesn't dislodge the filling or doesn't cause it to crumble, this means that it is ready to be carved. If it started too early, the plastic amalgam may be pulled or dislodged from the margin. Too deep carving or when the amalgam is set, bulk of the marginal area may be reduced and may fracture at margins under masticatory stress. So this has to be done very carefully, and we have to ensure that we rebuild the anatomy, not compromise it further. And so that is why it requires a lot of skill and expertise. Occlusal contacts basically, well, we have to ensure that the occlusal contacts are maintained. So if the patient taps his teeth together or moves them from side to side in contact, any area of contacts or high spots show up as bright areas or spots. So this is very important that we should ensure that the occlusion is basically maintained, and any kind of lost occlusal points are basically regained again with the opposing teeth. Spherical amalgam is easier to carve than the lathe cut, and fine grit products are easier to carve than the coarse grain. Then comes the step of the burnishing. After carving, we require that the surface and margins to be smoothened because carving produces roughened surface, and we do that by burnishing. This is a kind of a finishing procedure, so the objective is to remove the scratches and pits. Occlusal anatomy is burnished using ball burnisher. So the instrument we use is the ball burnisher, and all the occlusal anatomy, the fissures, the grooves is rebuilt. These are what the burnishers look like. So the objective is to smoothen and polish the amalgam and rebuild the occlusal anatomy. Then finally the finishing and polishing, which is the last step of the amalgam filling and a very important one, because a well finished and polished restoration retains its surface appearance, it contributes to aesthetics, is easier to keep clean because if the surface is rough, it has more chances of plaque and calculus deposition, staining, and it contains microscopic pits in which acids and food particles can accumulate, and this can lead to pitting, corrosion, and galvanic action, leading to tarnish or corrosion. So finishing and polishing, there are a few principles for low and high copper admix amalgam. It is recommended that the finishing polishing be performed 24 hours during the second appointment due to low early strength. As we mentioned, that the amalgam achieves about 70% of its strength after 8 hours. And during this time, the patient is cautioned not to bite on the restoration. We advise the patient not to eat from that side, from basically where the filling has been done. However, in single composition high copper, because they have twice as the high strength as that of low copper, finishing may be done immediately right after placing the filling. And as I mentioned, that the newer amalgams are high copper single composition usually, so the finishing polishing is done straight away as soon as the amalgam sets, as soon as we have carried out the carving. And whereas in mechanical trituration, we just place the powdered alloy and mercury, which is the capsule and pestle, within the amalgamator. Uh, um, Let's look at the manipulation. It involves selection, proportioning, amalgamation, manipulation, polishing. So onset of mixing, onset of working, onset of setting, end of setting, and 24 hours the polishing. The placement and condensation takes place in the start. Then as soon as the onset of setting takes place, we do the carving, and end of setting we carry out the burnishing, and after 24 hours, in case of low copper or admix high copper, we carry out the polishing. So the manipulation or steps of amalgam filling are very important. They've been asked before in your UQs, so you should have good knowledge, and you should be able to also verbally explain these steps if asked in the Viva. So let's talk about the advantages of amalgam. Firstly, it is very cheap, easily available. It has basically simple manipulation and procedure, and it is not time consuming to perform. It has good mechanical strength, adequate resistance to fracture, maintains the anatomical form, it is very durable, it has good clinical survivability, long term clinical survival. Decrease marginal leakage as the restoration ages. Why? Because we said that the corrosion products actually are beneficial as they deposit at the interface and provide a self sealing uh, margin all around the filling. Now, the disadvantages obviously, the first and the major most one is the aesthetics. It does not match the tooth color, and the current preference or demand is for tooth colored or aesthetic materials. So it has a silver black appearance, does not bond to tooth structure. So unlike other materials we'll be studying later on, like composites, this does not bond to tooth, and for its basically for it to actually get compacted into the tooth, it requires extensive cavity preparation for retention. We have to sacrifice a lot of tooth structure so that it stays and it retains inside. High conductivity, because it's a metal, so we cannot give it just like that. We have to give an insulating base or liner underneath it. It undergoes corrosion, creep over time, leads to ditching and marginal breakdown. Mercury toxicity is a concern, and that there is a lot of controversy regarding the mercury toxicity, but however, it still is a hazard. And then the other disadvantages like galvanism and tarnish and basically creep, it's already mentioned over there. So if we compare it with resin composites, the direct filling material we'll be studying in the next lectures when we're finished with amalgam. So composites are more aesthetic, more technique sensitive, placed with less removal of tooth structure. They bond with tooth. They are already thermal insulators. They do not have any corrosion, and they cause less of a biological hazard. So you're often asked to basically compare between composites and amalgam. So just remember the advantages and disadvantages of both of them. So, a very important question that has been asked previously in your SEQs. What does the success of amalgam filling depend on? Well, if we start from the beginning, it depends upon the cavity design when you are making the cavity within the tooth. So the removal of caries, smooth and flat floor, rounded margins, a cavo surface angle of 90, sufficient bulk of material at the isthmus. These are all clinical basically clinical uh, factors that you have to that you have to keep in mind when you are making preparing the cavity for amalgam. Like I said, you will basically learn about them in detail in your clinical subjects. Selection of alloy, again, high copper has the best properties. However, will you use spherical or will you use lathe cut? Will you use admix or will you use single composition? The ratio of the alloy mercury Ames technique 1 is to 1 is the best technique. So you should keep that in mind. Trituration method, whether it's manual, whether it's mechanical, but proper mixing should be there. Isolation or moisture control, again very important. Why? Because saliva contamination can lead to failure of the amalgam filling. Manipulative variables, all the steps which include condensation, burnishing, carving, finishing, polishing. Obviously, if there is any mistake in either one of these steps, that can cause failure. And then the polishing, finishing, obviously a good polished and finished restoration is lasts longer, has better aesthetics and better properties. So these are all the factors that determine the success of. If you look at amalgam failure, causes are fracture are the marginal fracture, the isthmus fracture, bulk fracture, and tooth fracture, and secondary cases. Postoperative sensitivity, dislodgement, discoloration, periodontal disease if the oral hygiene is not maintained, and pulpal damage. So, factors leading to failure include the constituents or the ratio. If there's basically, if you use low copper, there's more gamma phase, greater possibility of expansion, more creep, less corrosion resistance, a weaker restoration. And then with mercury, more prolonged second stage of amalgamation, more expansion. Um, the particle size, smaller size, more surface area, and then ultimately contraction. So again, all these factors contribute to the dimensional stability, and obviously that contributes to failure. Dentist control factors, so the factors that are in your hand, the improper case selection. So if the patient is not an ideal candidate for an amalgam filling, that is where the first that is the first mistake you make, when you actually, when that person is not the ideal candidate and still you go ahead and give him or her an amalgam filling. Improper selection of alloy and mercury, improper cavity preparation, improper manipulation, improper pulp protection. You do not protect the pulp, you do not give an insulating base. Improper matrix adaptation and contamination due to moisture, due to saliva. So, these are all the clinical factors that may contribute to failure, and these are basically due to the dentist or basically due to the operator. Patient related factors. Now, these are the factors related to patient. The foremost one is oral hygiene. If the patient is not maintaining his oral hygiene, it has heavy calculus deposits, periodontal disease, gingivitis, that can lead to failure of the filling. Excessive stress. Yes, stress has also been linked to failure of amalgam filling. Malopose occlusion, galvanism, parafunctional habits like bruxism or tooth clenching, failure to follow instructions. Well, you've told the patient not to basically have any kind of hard food or chew bones or hard things from that side, because obviously it's a filling, it's an artificial restoration, it's not the natural tooth, but the patient fails to comply with the instructions, that can lead to failure. Tarnish and corrosion, mercury level, surface texture, galvanic action, moisture contamination. These are all the factors. Marginal deterioration can be due to improper cavity design and finishing if there is excess mercury, creep, corrosion. So these are all the basically factors that can cause failure, and further the reasons of the fact that these factors can occur. Now let's move on to the last subtopic of this vast topic, that was a dental amalgam, the mercury toxicity. This has been a cause of controversy all over the world. That does actually mercury present in amalgam cause toxicity, or is it all just a big hype? So, concerns on use of mercury in oral and white wet was there for more than 170 years. Biocompatibility issue was basically due to the reason that it could cause allergy or size and shapes of condensers. They are small condensers which are 2 to 3 millimeter in diameter, and they affect more pressure and they're more effective. Used for low copper amalgam because we need to remove the excess mercury. Larger condensers on the other. Now, toxicity. This basically is the ability of the material to cause injury to biological tissues, improper biochemical function, organ damage, and cell destruction leading to death. Now, what are the sources of mercury other than dental amalgam? Diets, it's a major constituent of seafood, water, air from coal burning, volcanoes, occupational exposure as well from batteries, thermometers, fluorescent lamps, and obviously amalgam restoration. So, WHO estimates that eating seafood once a week, the mercury level in the urine rises from 5 to 20 micrograms per liter, and that is 2 to 8 times the level of exposure from amalgam, which is just 1 microgram per liter. So, concerns on use of mercury in oral environment was there for more than 170 years. Biocompatibility issue was basically due to the reason that it could cause allergy or toxicity. Now, the basic culprit is the mercury vapor. As you know, mercury is volatile at room temperature because of its high vapor pressure, and 20 micrograms per cubic meter of air. This is 400 times the maximum level that is considered acceptable. And why it is dangerous? Because it has no color, odor, or taste, so it cannot be detected. So, because it's more dense than water, a small spill. Now, mercury vapor can arise from amalgam during tituration, condensing, setting, polishing, removing, and also when the patient is masticating and drinking hot beverages. So, under normal conditions, this vapor pressure is reduced because mercury is covered with saliva, and we usually cover it with sealant resin for several days. And because of the fact that indium about 8 to 14% is present, so that reduces the vapor pressure and in turn decreases the mercury toxicity. Fresh amalgam, however, releases more mercury as compared to 2 years old amalgam. So, if a patient with amalgam restoration was monitored for mercury vapor inhaled over a 24-hour period, and it was noted that it is just 1.7 micrograms per day. And in patients with about 8 to 10 amalgam restoration, it was from 1.1 to 4.4 micrograms per day. So this was too low when compared to the value for workers in the mercury industry who actually inhale 350 to 500 micrograms per day. So again, like I said, there are mixed views about the toxicity. Um, there is one school of thought that says that it is too less, as you can see from the figures that tell about a patient with 8 to 10 amalgam restorations, and the other school of thought says that no, it's still toxic and should be avoided altogether, and that those countries, especially the Scandinavian countries, have stopped using amalgam since past 10 to 15 years, and they've shifted to the composite fillings. So the maximum mercury concentration in a filling is at the marginal areas in amalgam restoration. So at the marginal areas where there are also the corrosion products, the maximum mercury now, the OSHA basically recommends that the maximum safe occupational exposure is 50 micrograms of mercury per cubic meter of air per day. This value is very important, and it's usually asked in the viva that what is the maximum safe exposure or allowed amount. So it's 50 micrograms of mercury, and the threshold level is 0.05 micrograms per meter cube, and this is the maximum amount of mercury vapor allowed at a workplace. And it is said that all dental offices should comply with this standard, and basically there should be gauges or proper monitoring should be there so that this amount is not exceeded. And it has been estimated that 1 out of 10 dental offices exceeded the safe limit. Now, what are the roots of mercury into the biological system? So, mercury can be absorbed through the skin by direct contact, like for example, if there is a spill, or when if you're handling mercury, you're triturating it mechanically, and you do not wear gloves, or for some reason your hands or your skin contacts the mercury. Ingestion, if it's basically ingested or swallowed, or inhalation, which is the most common risk because of the mercury vapor. So there are different variables in the mechanical titration like the speed, the oscillation, and the speeds are mentioned here. But like I said, you don't have to go into the detail. You just have to know that there are two kinds of titration, the manual and the mechanical, and just a few. So it was seen that the peak urine mercury level after 4 days of placing an amalgam filling was 2.54 micrograms per liter, and then after 7 days it returned to zero. And on removal of mercury maximum, it was 4 micrograms per liter and returned to zero after a week. Peak mercury urine levels are about twice as great when amalgam is removed than inserted. So basically, removing an old amalgam filling also causes the release of mercury. And if we look at the fact that eating seafood once a week raises the mercury level to even more than the amount found in dental amalgam to about 5 to 20 micrograms per liter. So that is about 2 to 8 times that the level of exposure from amalgam. Neurological changes within the body are detected if the urine mercury level exceeds to 500 micrograms per liter. So the exposure from amalgam is way low than the threshold amount. So again, like I said, there are mixed reviews. Which really doesn't seem to cause toxicity if you look at these figures. But again, there have been cases that have been reported of patients who have suffered from mercury toxicity. So, average mercury level in patients with amalgam zero point 0.7 nanograms per ml compared to zero point 0.3 nanograms per ml in people with no amalgam. So, it's very minimal, it's very negligible the difference. And seafood raises the average blood mercury level from 2.3 to 5.1 nanograms. Dentists and assistants are more affected. Inhalation of mercury during mixing, placement, or removal, or due to mercury spills in the dental. So there are different variables in the mechanical titration like the speed, the oscillation, and the speeds are mentioned here. But like I said, you don't have to go into the detail. You just have to know that there are two kinds of titration, the manual and the mechanical, and just a few lines about how they're both carried out. So, what are the systemic effects of mercury toxicity? In the previous slides, we discussed the local effects. Now, let's look at the systemic effects or the different effects of mercury on the organ systems. So, if a patient with amalgam restoration was monitored for mercury vapor inhaled over a 24-hour period, and it was noted that it is just 1.7 micrograms per day. And in patients with about 8 to 10 amalgam restoration, it was from 1.1 to 4.4 micrograms per day. So this was too low when compared to the value for. So average mercury level in patients with amalgam zero point 0.7 nanograms per ml compared to zero point 0.3 nanograms per ml in people with no amalgam. So it's very minimal, it's very negligible the difference. And seafood raises the average blood mercury level from 2.3 to 5.1 nanograms per ml. So if you look at the doses and the effects, the systemic effects, it's been seen that 500 micrograms per kg body weight, what basically mercury toxicity does, it leads to paresthesia. Then 1000 micrograms per kg body weight leads to ataxia, and then further on joint pain, hearing loss, and death. Now, mercury vapor can arise from amalgam during titration, condensing, setting, polishing, removing. and also when the patient is masticating and drinking hot beverages. Now, effect of mercury on the teeth and the associated structure, it can lead to gingivitis, stomatitis. Mercury may penetrate from restoration into the tooth, and it can basically lead to staining, can reach underlying dentine or even pulp. It can lead to a condition called amalgam tattoo. So basically, that appears as a bluish darkening of the gums. There have been reports of inflammatory reactions of dentine and pulp. So this is basically a localized reaction on the tooth due to amalgam. Mercury was found in the lysosomes of macrophages and fibroblasts in some patients. So finally, so these were all the adverse effects of mercury. Now, how, as a dentist, can you avoid these hazards? What are the safety precautions you can? Precautions include a very well ventilated operatory so that any kind of vapor may get flushed out. Use of protective wear, gloves, mask, goggles. This is for your own protection. That whenever you are handling amalgam fillings, if you're carrying out the finishing and polishing, so you wear gloves, masks, and goggles. Excess mercury waste, disposable capsules, and amalgam removed during condensation. So basically, mercury requires to be disposed of and stored properly. It should be collected and stored in well sealed container with a proper fixative solution. It should never be flown into the sink or flushed down the toilet, nor should it be thrown out into the environment. So, and again, proper disposal to prevent environmental pollution, because again, it basically is a hazardous material and we don't want it to go into the environment. So these are just the basic simple precautions you can carry out to avoid mercury hazards and to minimize them. It is recommended not to place carpeting in the dental office, because if there is a mercury spill, it is difficult to clean. Amalgam scrap and materials are contaminated with mercury should not be incinerated, so that means it should not be burned. No kind of heat treatment should be done. If mercury is spilled, it should be cleaned as soon as possible, and that too with proper mercury spill kit. Vacuum cleaner should not be used. Mercury suppressant powders or spill kits are present, which are helpful to actually clean up the. And further on, when we are carrying out tituration, reusable capsules should have the tightly fitting cap so that we can avoid any kind of mercury leakage. If mercury, however, does come in contact with skin, you should wash the area immediately with soap and water. While grinding or finishing polishing amalgam, water spray and suction should be used within the patient's mouth, so that again the risk of mercury exposure is minimized. And eye protection, disposable mask, and gloves should always be used. So these are just the precautions that, as a dentist, you should take. Should be your responsibility to minimize the mercury hazards, but not only yourself or the patient as well as your dental staff. So that brings us to the end of dental amalgam. This is a very vast topic, and as you must have seen from the objectives, that there is a lot to cover in this within this topic. I hope I've covered all of them clearly, and if you have any questions, please feel free to ask me. Thank you again for your time.